I am Asha Clinton. I am an energy psychologist, and over the last 20 years, I developed a new form of therapy called Advanced Integrative Therapy. It works with emotion and with trauma a lot more efficiently and powerfully than the ways we used to work with emotion and trauma. So I recommend it to you highly. We've also had, obviously, a lot of experience with AIT since it is now 22 years old. What I've come to do today is to give you a little talk about trauma and about emotion, especially in the context of the COVID-19 pandemic. And I've brought with me 3 simple methods which you can use to help yourself feel less anxious, less frightened, and less stressed. So you could say, I'm bringing you a solution to a temporary solution to a problem, that is to say the pandemic, that we will all be dealing with in terms of the trauma it causes for many years into the future. But meanwhile, here's some help. Most of us have been traumatized from the time we were kids. If one of your parents hit you even once, you've probably been traumatized. And if you had a serious illness, or if a parent abandoned you because there was a divorce, or if you were caught cheating in school, or went hungry, or one of your parents was addicted to alcohol or drugs, there are so many kinds of trauma that there's no way I could even begin listing them all. But what you need to understand is that once we've been traumatized, the negative energy that a trauma generates in us tends to settle in our body's energy centers and stay there in us until it is removed. So let me talk a little more about trauma, and then we'll go a little further. From the perspective of AIT, which is the psychotherapy that I do, trauma is any occurrence which, when we think about it or when it's triggered by some present event, makes us feel difficult emotions and physical sensations, negative beliefs, change our patterns of behavior to something that isn't as good as how we were doing it before. And we could, for example, change from being a gentle, sweet person to a bully or a victim. Trauma can block our succeeding in life, as well as the development of positive qualities and relationships. It can block spiritual development in those of us who are interested in having that. And it very often fractures human wholeness. Traumas can be upsetting both while they are happening and afterwards. They harm us physically, psychologically, and spiritually, and often require therapy for them to be healed. Most of us, if not all of us, have already been traumatized by the COVID-19 pandemic. Some of us, for example, were afraid we'll catch it and die, or that someone else we love will die. We're afraid that our country's government might be destroyed, or that we'll become homeless and poor. So many, many realistic fears, so much genuine anxiety and stress. And we feel helpless, many of us, to protect ourselves, to protect our families, to protect our country. More traumas. Rather than just talking about trauma and the emotions it brings up, such as anxiety or stress or fear, I'm here to teach you 3 ways: one physical, one psychological, and one spiritual, that you can use to treat any feelings and traumas that might be upsetting you as this pandemic goes on day after day. These are very simple methods that anybody can use and that we teach in Advanced Integrative Therapy. That's the energy psychotherapy that I've developed over the past 20 years. Please do the methods along with me as I explain them to you. That's the easiest way to learn them. And I will make sure that you are emailed a list and description of those methods. So the first one is called Cook's Hookup. It is especially good for removing stress, anxiety, and fear, which are natural emotions that we often feel when we're traumatized. This method works directly on the body's energy system and on the body's nervous system. So there are 7 very easy steps. Please do them as I say them and do them also. The first one is to sit down. This is hard to do if you're standing up. Second, as you're sitting there, let yourself turn inward and notice the emotions that you might want to remove that you're feeling right now. Maybe you're a healthcare worker and you need to go to the hospital to help a lot of coronavirus patients. And maybe you're scared for good reason because you need to have enough protection for yourself and you're not sure you do. Maybe it's something else. But notice those emotions and notice how intense they are. And now cross your left ankle over your right ankle. Put your left hand on your right thigh. Put your right hand on your left thigh. So now, for example, my ankles are crossed and I have one hand on each thigh. Now put your tongue on the roof of your mouth just behind your front teeth. It's a weird kind of position, but as you will see, it's very helpful. Now sit back and relax, keeping your hands on your thighs, keeping your ankles crossed, keeping your tongue just behind your front teeth. And see what happens as you sit there quietly. And I'm going to leave you in that position just for a little bit so that you can actually feel the change between what you felt before we started and what we're going to feel when I ask you to stop. Okay, now remember how those feelings felt before we started. And now notice how they feel now. Now you're probably only going to notice a smallish kind of change because we didn't sit in the position for that long. But I assure you that if you sit in that position for 5 or 10 minutes, you will feel a shift in what's going on inside you. What I commonly feel is increased relaxation when I do this, and finally, a peaceful feeling. The time I used it most happily was when I was flying from home to San Francisco to teach there. And there was a young woman in the seat behind me, and she was having a panic attack because she was so afraid to be in a plane when it takes off or when it lands. So I saw this and I asked her if she would like some help. And she said she would love some help. And I put her in this position, and I told her to stay in this position until the plane had fully taken off and was flying at a uniform altitude. I dozed off once I went back to my seat and didn't wake up until she tapped me on the shoulder. And she was very grateful. She said she had done exactly what I had shown her, which was Cook's hookup, and that she did it while the plane was taking off and while the plane was landing, and that she had no panic. So that gives you some sense of how powerful this very simple method can be. So I really recommend it. Okay, so that is the method that we use if we want to directly work with the body, because that's what it does. Remember that your brain and the parts of your brain that are involved in emotion are a part of your body, and we were working with that. Now I want to show you a more complicated way of working, but still not very complicated, that anybody can do, that will deal directly with the emotions that you feel and works directly on the psyche. So rather than explain it to you, what I'd like to do is have you do it as I explain it to you. So this will remove really any emotion. And it begins by doing Cook's hookup for 2 minutes. That way we don't have extra friction, extra tension, extra anxiety because we haven't done our Cook's hookup. So again, cross your left ankle over your right ankle, put your left hand on your right thigh, your right hand on your left thigh, and your tongue behind your top front teeth. And we'll pretend we're doing it for 2 minutes. Now, if you have any quickly handy, please drink a little bit of water. A few swallows is enough. And get used to doing that anyway when you do these exercises, because it always helps the body to deal with the energy shifts that we're creating. And then, starting right at the hollow of the throat, bring a couple of fingers down 3 inches and across the chest for 3 inches. And if you rub there, you will find that there are sore places there. So rub those sore places for a couple of minutes. And this is still just the preparation. I'm not going to have us do it for 2 whole minutes, but I want you to get the feeling of it at least. Okay, so let's pretend we did 2 minutes of this, rubbing the sore points as well. Now we want to create a phrase that describes what you are feeling that you would rather not feel. Maybe it's anxiety because of something you know is going to happen soon. Maybe it's a lot of fear. For example, a lot of people get pretty scared here in the United States when they need to go to the supermarket to get food. They're scared that some of the food they most want and need won't be there. but mostly they're scared that they will catch coronavirus from someone else who is there, or that someone they love will catch coronavirus. So I'm going to read you some phrases that people have been using recently that I have heard. First one is, all my fear, anxiety, and stress because I might catch COVID-19. Or all my fear, anxiety, and stress about going to work because I might catch COVID-19 at work. All my fear, anxiety, and stress about kissing and touching my husband or wife or lover because we both might catch COVID-19 from each other. All my fear, anxiety, and stress about reporting for my hospital shift because I might catch COVID-19 from my patients and die. All my fear, anxiety, and stress that we'll go hungry because I've been laid off. So those are just a few examples. Sit for a moment and see what your phrase needs to be right now. It doesn't have to be about any of the things I mentioned. There are so many dimensions to this COVID-19 pandemic that there could be hundreds of different phrases possible. So choose your phrase. And once you have it, we can begin to treat it. Okay, I'm going to assume, since I can't see you, that you've chosen a phrase. Now what I'd like you to do is to get in touch with the emotions that are connected to that phrase. For instance, in most of the phrases I told you that were examples, I used fear, anxiety, and stress as the phenomena that I wanted to remove, because that's what mostly I hear when I'm working with people in these last weeks. So feel the single feeling or the feelings, whichever is the reality, that you would like to treat and get rid of. And feel their intensity. In fact, see on a scale from 0 to 10, where 0 indicates no fear, anxiety, stress, or whichever emotion you're trying to treat, and where 10 indicates the most fear, the most anxiety, the most of the emotion that you're trying to treat, that you could possibly feel. So you're going to come up with a number between 0 and 10. And I want you to accept the number that you chose as a valid estimate. Now we're going to use our two hands differently. One hand is going to stay in one place at one of your energy centers. These are the large energy centers that are in a row down your body, down the center of your body, with a couple of exceptions. So we're going to call one of your hands, it's your choice which to use, the stationary hand. And that means that it's the hand that stays on one energy center, because that energy center is likely to hold the most traumatic emotion. And for this kind of phrase, I would treat the heart center, which is right there on your body as well as on mine. And I'm going to take the hand that's not going to move and put my palm directly on that energy center, as you see it here. So the center of my palm is on the center of the heart center. And for many emotions, that's the best place for it to be. Now, the second hand, and again, it doesn't matter whether it's your right or your left. This is the moving hand, and it is going to move down your energy center, starting with the crown center at the top of your head. And you're going to put your hand on that center, and you're going to say the phrase that you chose. And we're going to move from center to center at the same time because you're learning where they are. Normally, once you know how to do this, you would move from center to center each time it felt like your hand was ready to go to the next place. So you'd sort of be feeling whether the emotion was draining down. So let's start with the hand on the crown center. Say your phrase. Now move your palm or 2 fingers. I use 2 fingers because I wear glasses and they get in the way. So the palm or 2 fingers on the forehead center, say the same phrase. On the chin center, and say the same phrase. On the throat center, same phrase. On the heart center, and you can see that one palm is above the other. So we're moving to the heart center and saying the same phrase. And then we have a couple of extras that aren't as powerful as energy centers in the body, but are very important anyway. So on the left side of the heart center, and say the same phrase. On the right side of the heart center, and repeat that phrase. On the solar plexus center, repeat the phrase. On the navel center, and my palm is right over my navel. On the pelvis center, and here my fingers are right above my pelvic bone. On the left crease, and what I've done here is put 4 fingers, one after the other, on the crease between my left leg and my torso, and say the phrase. On the right crease, same thing, say the phrase. And finally, on the root chakra is between your anus and your genitals, and repeat the phrase. Now take a deep breath. Remove your hands from wherever they are. And now remember the feelings, and if you've been working with what caused the feelings, most of the phrases I gave you showed the cause, which was COVID-19, as well as the emotions. So come back to remembering what the phrase says, and to the emotions that have been generated by what the phrase is about. And estimate on that same scale from 0 to 10 where your emotions are now. If you estimate that there is 0, you have finished treating that phrase. If they're anything more than a 0, like a 7, a 3, whatever, then you need to repeat what we just did, which is the treatment. The hand on the energy center, repeat the phrase. Hand on next energy center, repeat the phrase. Hand on the next and repeat, and so on until you've gone all the way down to the root center and repeated the phrase. And you would repeat that whole thing. We call this a round because it goes from top to bottom and doesn't leave anything out. You would repeat around until you came to a 0. So many times, especially with people who haven't tried this before, the first time you might feel it's a 10, especially if we're talking about the kinds of life and death issues that the pandemic has brought up in us. So it might be a 10 before you treat it the first time. After the first treatment, it might be a 7. And after the second treatment, let's say it could be a 3. And after the third treatment, it could be a 0. It doesn't matter how many rounds you need to do. What matters is that they can be a 0 and you can have relief from those feelings. The other terrific thing about this is that you can not only do it as many times as you want, but if you do it long enough, the likelihood is that you won't have to repeat it again about the particular trauma, about the particular emotions that you've already done it a few times with. So it's a little bit of work, but it feels wonderful not to have those feelings back. I know for me, if my feelings are intense enough, it's difficult for me to function by thinking. And when I go to work, I need to be able to feel and to think. You may find that this is the way it is for you as well. Okay. So these are the first and second gifts I have for you. Now I have one more, and it's a meditation. It's a meditation that if you do it daily, puts you in a much better general state of mind. Much lighter, much less emotional, much more peaceful. So let's begin by doing Cook's hookup again. Cross the left ankle over the right hand on the left thigh, the left hand on the right thigh, the tongue behind 2 front teeth. And I'm not going to do it for the full 2 minutes because we're running out of time. So then let's rub our sore points. And now, since this is a meditation, please sit with your back straight in any comfortable position. But if your spine is straight, meditation works better. Close your eyes if you're comfortable doing so. If you're not comfortable closing your eyes, please sit with your eyes open and look at the floor or the ground in front of you without focusing. Now focus on your ego. The ego is very often the voice that you talk with inside you, or it's that sense of strength and pride, or it's about how we organize ourselves, how we do all the things that we have to do in life. So it's the part of us that does the business of living. Let's put it that way for the moment. Experience what's going on with your ego right now. Maybe it's feeling critical because it would have liked to treat more things with our quick AIT, the method that we just did. Maybe it's feeling better because you cleared something really helpful to clear. The ego can be in any place with any energy. Now, what I'd like you to do, having focused on your ego a bit, having sort of recognized your ego as the I that you mostly define yourself as being. So ego is I. Now I'd like you to visualize a bridge in front of you, and your ego is at one end of the bridge. You're there with your ego because ego is I, right? And see if you can see the entire bridge. And ask your ego to cross that bridge so that it can meet your center. Now, your center is the part of you that is the divine spark in every human being. Whether you know it's there, whether you recognize it or not, it's been there since you were born and will be there until you're gone. It's the part of you that provides the really good guidance you get internally. So ask your ego to cross the bridge and to connect with your center. And let yourself fully experience the crossing of the bridge and what happens after it. If your ego and center don't connect, that's fine, no matter how that happens. Sometimes we are not ready for the ego and center to meet when we begin practicing this meditation. It's important to give it the time and the space for all the pieces to occur. So it's fine if you connect ego and center. It's fine if they don't connect. It's fine if they connect just a little or for just a moment or two. All of these possibilities are fine. They are exactly where you are, and they are exactly where you need to be. And just allow yourself to experience what is happening between ego and center, between ego and bridge. So see how you are feeling now, having had this experience with ego, bridge, and center. Most important, See if you are feeling differently now than you felt before you started doing this meditation. And if so, how are you feeling differently? What's different? Has something healed? And if it has, what? And at the end of the meditation, we always say hallelujah or an equivalent word that is appropriate for you given your religious, spiritual, and cultural background. So that's it for today. Thank you for your attention. I welcome you to learn more about AIT by taking AIT Basics, which is for psychotherapists, or AIT Fundamentals, which anyone and everyone can take. And it is full of good methods like these three that we've worked with today. It is full of ways to help you heal and to help you help yourself to heal. You can find out more about Advanced Integrative Therapy, which is what AIT stands for, by looking at our website in the United States, ait.institute. Thank you.